Uh, some of the people who start taking redox signaling supplementation or use the redox gel notice a cleansing process that happens. Sometimes it's uncomfortable. It usually shows up in the form of a rash or a headache or feeling tired, like you need to take a nap, or GI symptoms, sometimes a little numbness or tingling, just things that aren't that comfortable. It's important to know this only happens a small percentage of the time. And we never know who that's going to happen to, but we congratulate them because it's actually a true cleansing process as the body starts to function the way it was designed, as we increase the amount and the balance of redox signaling molecules in the system and on the skin. We find sometimes that it improves so quickly. We find that as their body gets used to an increased amount and balance of redox signaling molecules inside and outside on the skin, we sometimes see very quick cleansing of cellular debris. We call it metabolic wastes. And as those things are looking for a way to get out of the body, as the body cleanses itself, it sometimes comes through the skin or comes through organs. And it's a very interesting, awesome process. It means people are getting better very quickly. And we try to mitigate that by having them drink extra water, good pure water. Coffee and tea don't count. And sometimes we have them decrease their supplementation of redox signaling just a little bit in the beginning so that the body's cells can catch up and start doing their job a little more slowly and a little more comfortably for the person drinking it or using it on their skin. So we recommend that people follow the directions, which is 4 ounces of redox signaling supplementation each day. That's what our studies were done with. But sometimes people need more. So people who have bigger challenges, if they have bigger demands, if they're athletes, if they have something that they've been trying to get their body to rid itself of for some time, sometimes for years, sometimes they need to see specialists, we like to see them drink more. It's important to know that there's never too much. You can't take too much redox signaling supplementation or put too much redox gel on your skin. The only problem is not using enough. And there's no problem. There are no side effects. There's never been a known side effect. And just use more. Usually people who are young and healthy use the usual 4 ounces per day. When people are older and healthy, they use more. When they're young with a health challenge or they have athletic needs that they want to support, they take more. And if they have bigger challenges, we like bigger amounts because you can't go wrong by taking too much. When people start taking the redox supplement as a drink, they, of course, would like to notice a change immediately. We all do. There's a difference between your body improving and you perceiving that your body is improving. So I tell my patients that if they're going to use the redox signaling drink, that I want them on this for 90 days. The great percentage of people who use this product, within 90 days, they will have a perceptible change. We know from our studies that within minutes, this product is changing metabolite levels in the blood, all in positive ways. So if people aren't noticing something, first of all, know that it is working. It always works. And after about 7 days, if you don't really notice a change, bump it up some, increase it by another few ounces per day, and stay there. And remember that there are no amounts that are too high, just too low. So just keep using it and feel free to use more. And sometimes with my patients, I have them drink a lot, 2 days in a row. Sometimes I have them drink a whole bottle over a 2-day period. And on that 3rd day, they'll come back and say, you know exactly what was going to happen. I feel so much different. It's always important to remember that you can't make redox signaling supplementation unsafe. It is safe for everyone. It doesn't matter what your age, what your condition, how old you are. If you're a newborn baby, you can use the product. If you're over 100, you can use the product. It doesn't matter what medicine somebody may have prescribed for you. It doesn't matter what treatments you may be going through, whether they're supplements or something that your medical doctor has suggested for you. You cannot make this unsafe. There are no side effects. There are no contraindications. There is nothing that would preclude you from using the drink or the gel. Just use it. So when we drink the Redox supplementation drink or we use the gel, some people get concerned if their medical doctor says a change in your immune system would change the way we want your outcome to turn out. It's important to know that that's not the mechanism that redox signaling supplementation works on. So it enhances the ability of the body to repair cells that need to be repaired and the body's ability to rid itself of cells that need to not be there anymore. It doesn't increase an immune response that the body shouldn't have, that's improper at any time. It just enhances proper immune response. So we never have to worry about what it is that's going on in our bodies. There's never a time that you should not take redox signaling supplementation. When supplementing with redox drink, it's important to know that we watch certain things because the body sometimes responds so quickly and so beautifully as it now can help itself get better. So people who need to monitor their blood pressure, they should do it at least every day. Sometimes as the body is supplemented with these redox signaling molecules and the body cleanses itself and the cells dump metabolic waste and junk into the bloodstream, it makes the blood a little thicker, and that causes sometimes the kidneys to say, we need to get this stuff out faster, and it may increase blood pressure a little bit, always in manageable ways. But if you have a concern about blood pressure, make sure that you're taking it daily, drinking plenty of fresh, clean water. And if your blood pressure goes up any higher than is comfortable, just decrease your redox signaling supplementation, cut it in half, increase your water, and as that stabilizes, I think you'll be very happy with the outcome. So when we take redox signaling supplementation, all our studies prove that we should stay on redox signaling supplementation to improve our body's cellular function. People ask, patients ask, what happens when I go off it? The answer is you'll go back to the way that you were. You will continue aging the way that you were. Your oxidative stress levels will continue going in the direction that they were before Asea, and before too long, they will realize that they want to stay on a product that keeps them aging in a proper way and their body staying as healthy as possible, as healthy as the cells will allow. We say long-term use of Asea cures skepticism. One of the most frequent questions that we get about redox supplementation, the drink, is how much sodium is in that product. So on a 4-ounce dosage, it's 125 milligrams a day. That is a minuscule amount. It's the same as a piece of whole wheat bread or a few carrots. It is not a high amount of sodium. When you see the levels of sodium that most Americans take in, that's closer to 4,000 or 5,000 milligrams a day. If you're following guidelines and you're trying to stay healthy, it's about 2,300 milligrams. So this is about 5% of what you should be taking in each day in sodium. It's minuscule. It shouldn't scare anyone. If you are on a sodium restriction, check with your doctor, of course, but this is minuscule.